I understand from Prisha we've got time for one or two questions. So are there one or two questions perhaps from the committee? Yeah.
Yeah, thank you so much for this wonderful presentation. Earlier, the committee actually met and we discussed that it is very difficult to address social determinant or to teach social determinant of health, actually, like in just in curriculum. But you gave a very wonderful elaboration of how you're doing it by having this 10 hours per month in the first 3 years of these medical students. So I want to congratulate you for that, but also we wanted to know, for example, how do you assess their experience or the success actually of this program, and what's the feedback that comes from the students that participated in this wonderful experience actually in Belgium? Yeah.
Yes. So the program that I presented to you earlier in the presentation was actually was not a Belgian but a US based program where it was really embedded into the whole curriculum. And to my knowledge, there is this program, and indeed also in Ghent in our university we try to do this. And maybe I can talk from my experience here in Ghent, because I was exactly appointed at the University of Ghent here to build a continuum on social determinants of health into the medical curriculum. I must say, from my own experience, it's not easy. Neither to have it incorporated in the medical curriculum, neither because I have to convince my colleagues in the medical school that this is an important topic and this needs time in the program, but also to convince our students that this is important. And we also make this continuum in our curriculum, starting from year 1 to year 6, because we have a 6-year program in Belgium. And I must say, I just got back the evaluation from last semester on our social determinants training program in the first year, where we have about 400 students in our first year, and I had about 50 students indicated that they were asking the question, why is this needed? Why do we have to learn about this? And this is something that I hear my students saying throughout the curriculum. Some of the students say that. But what I see is that once they go out and they go on internships, or they become a doctor, I have sometimes students that come back to me and then they say to me, you know what, the lessons that you taught us in the first year, they really make the difference today in my daily work. And so it's a difficult thing, I think, to convince students that this is an important thing, because the medical students that we find in our first year, they want to be a doctor. They want to cure people. They want to look at diseases and curing a disease. They're not interested in the first place in the social determinants of health. I must say, however, I'm talking from a perspective of a university where there is free access. In Belgium, we have an academic system where all students can register for the medical program once they pass a test. So we don't select our students. We have a wide range of students. And I can imagine that in universities that are specifically working for deprived communities or are located in areas and writing down in their mission that they're working for the local community, this can be very different. But still, we don't find a lot of evaluations in the papers that we read. Evaluations were merely asking the students, what did you think about it? Did you like it? Do you think that you reached the goals? And students say yes. But there are no strong evaluations up to my knowledge.
Great. One more question from Lara.
Thank you very much, Sarah, for your presentation. And I was wondering, the results that you present are concentrated in courses. In your study, did you get along from other strategies, for example, curriculum integration or extracurriculum activities of the universities? Did you find something else,
yes.
Another strategy, and what would those be?
Yes. Yes, about half of the papers that we found were describing courses in the curriculum that all the students have to follow, but about half of them were elective programs or even extracurricular programs. Yeah.
Okay, I think we will be able to look, I understand, tomorrow and come back to your presentation because it was so rich and there was so much in there. I think we'll need to sort of digest and have the opportunity to come back tomorrow. I think it has thrown up some excellent issues, particularly around the evaluation. That I'm sure if you did a literature search for social determinants, you'd come up with, literally thousands of papers, and here with education, only 30. So it shows that, education is lagging this, quite significantly. And also, if you look at the Commission report, I think it was the lady colleague from social work was saying, if we're looking at sustainability, then we need to evaluate so that we can show results.
Absolutely.
So I think there's a couple of, good questions. So on that note, I would like to again thank you and your team in Belgium.
Thank you.
So I assume you're trotting off for some nice red wine in the evening sunshine, and we'll go for lunch. So thanks very much.
Yeah, thank you. Bye-bye. See
Ciao.
you tomorrow.